Alright guys, thanks for tuning back in. I know it's been 7-8 months since my last video, and during my last video I was talking about being diagnosed with testicular cancer and starting that journey. So on the welcome back video, let's do a cancer update, right? So let's get into it. All right, first and foremost, I want to say thank you to everybody for their thoughts, their prayers, their well wishes, the comments, the support. It meant a lot to me to read that and to see that from everybody. So I truly do appreciate it. So thank y'all. I don't remember what all I said in the previous video. So, you know, if it's a little bit repetitive or, you know, you hadn't seen it, like whatever, it's cool. It's all good. We'll just start from the beginning with it. So, you know, I was diagnosed with the cancer. My chemo started September of last year, and I had 3 cycles of BEP cancer. It was 3 different chemo drugs that they give you, and the way the cycle worked for me, well, probably everybody. I mean, I think they do it different in the United Kingdom, you know, but I mean, you can Google it and look at it, because I when they told me that's what I was going to get, I went down a Google rabbit hole to find out about the stuff. But so my first week I got 3 drugs the first day, and then 2 drugs for the rest of the week, and then I went on Monday and got a treatment, and on the following Monday I got a treatment, and that was 1 cycle, and then it started over again with a full week, 2 Mondays, full week, 2 Mondays, and that's how it went. And let me tell you, there's nothing that can like prepare you for how your body's going to react to it, and everybody reacts different to it. You know, it's what I've learned. You know, we all have different reaction. We're all different individuals, you know what I mean? So we're going to react to drugs differently. So the first week went by, and it, you know, nothing hits you yet, you know. But then Sunday night, you know, going to the restroom, upset stomach. And, you know, I wish somebody would have said, like, you're going to want some dude wipes, you know, and you're going to want some hemorrhoid cream, because, guys, let me tell you, it got rough with the drugs coming out, you know, through me, passing that through me. So, you know, the bathroom stuff is what hit me first. And then, I don't know if I talked about this in the previous video, but I had a port put in like 2 weeks before my chemo started, and I guess where the initial incision was made for where they cut my chest open to put the port in, it took a long time to heal, and by the 2nd week of my chemo I ended up having an infection right there, and you know, I had to get on antibiotics and like was pushing pus and stuff out of it. So like, that hit me not that hard. That was an inconvenience, you know what I mean? But I was still fever, chills, like, you know, it probably could have been worse, but it did hit me kind of hard, I guess, you know. I mean, just for like those 3-4 days, and then the antibiotics kicked in, and then, you know, I was back feeling good from everything. The whole time I'm going through this stuff, you know, they're drawing my blood and looking at my blood and whatnot. I had, I can't remember if it was my magnesium or something went low, or maybe it was, yeah. And they were giving me pills because that stuff was going low. My chemo should have ended like the week before the week of Thanksgiving, but at one point I was supposed to go to my, I think it was either my 2nd to last or my last Monday appointment, and I woke up and I felt fine, felt like, you know, I had energy and stuff. Took a shower, and when I got out of the shower I was just completely drained, in the floor, in the fetal position, just couldn't move, couldn't do anything. I had to call the hospital and tell them I couldn't make it to the appointment. You know, had to call my parents. Ended up having my dad drive me for the remaining chemo sessions. Yeah, this was probably my second to last one, I think. From that point on, you know, I started having my dad drive me to my appointments because, you know, it just the fatigue and being tired from everything just kind of caught up with me throughout it all, and it was very interesting, you know, going through all that, because, you know, it kind of hits you, and you just, some days, for me personally, you know, some days were like really good days, and then some days, you know, I just felt like, oh, a worthless piece of crap, and, you know, I didn't want to get out of bed and didn't want to do anything, didn't have energy for anything, and it was tough, you know, but you know, again, that's like where y'all's comments and stuff that were popping up on that video, you know, helped me out, and then, you know, my parents checking on me and whatnot, so, you know, I mean, I was able to like get out of that mind space, but yeah, it sucked. Like, I ain't gonna lie, it sucked. That's one of the worst experiences that I've ever had, was going through the chemo. I'm trying to remember if there's anything else significant that can happen. I don't know, if I think of something else, I'll bring it up. But so go through the chemo, and they're watching my blood and everything, you know, keep me on drugs that I need to be on to keep certain stuff up, but it knocks your red blood cells down. So, you know, eventually it's like, yeah, I'm anemic. I still am. My red blood counts are low. My hemoglobin and hematobin or something. There's another hema thing that's low too. But go through all the chemo, and then they gave it like a month, if I remember, to see how the chemo affected the tumor. Well, come to find out, the tumor didn't give a crap about the chemo at all. It only shrunk by like an inch. So, of course, you know, when the doctors look at that and realize that, they told me it was a teratoma tumor, which, you know, does not react to chemo at all, or very little, similar to how my tumor reacted. So, that being said, the next process was to schedule a surgery to remove the tumor, and then, you know, they can dissect it and look at it and all that jazz. So that happened on the 3rd of March this year, and that surgery, it's a RPLND surgery, if you want to Google it and get into the weeds of it. But it was like a 10-hour long surgery. They cut me open, pull the tumor out, and then they also removed the right testicle too. Oh yeah, during the chemo treatment, there was a what do they call it, like a burned out regress tumor that they've seen on the right testicle, where the chemo did get that tumor. So they removed the tumor, removed the testicle, and then they also took out 23 lymph nodes around my abdomen area, around all the veins and all that stuff. So if I'll show pictures. If you're squeamish, don't want to see what it looks like, somebody being flayed open and a tumor inside them, look away right now. But here's the picture of me opened up, and the little alien baby head is the tumor, and then here's a picture of the tumor. Alright, so they do that surgery, Like, I went in at like 5 in the morning. They prep you for surgery and everything. And when I went into the operating room, you talk about something crazy. Like, I was not expecting what I saw in the operating room. Like, the room was way bigger than I was anticipating. And then, like, in the middle of the room, you know, there's like the operating table, or not the operating table, but like the bed for me to be in. And as they're rolling me in on the one bed from where they were prepping me, there were other doctors or nurses in there looking like chefs, laying out all the tools on a table and taking count of them and everything. And I remember just laughing to myself like, oh man, these people look like they fixing to fire up the grill and just cook out and getting everything ready for it. But yeah, that room was crazy. There were a lot of doctors involved in this surgery, because the type of surgery that it is, it's you know, it's not a easy surgery. But they do the surgery. They cut me open. Fortunately for me, like this what I experienced was the best case of a worst case scenario, I guess you could kind of put it. The tumor had grown from one of the lymph nodes, and it was on my intestine, but it wasn't invasive to the intestine. Like, it had attached to it, but it wasn't so far in it that they had to like remove the intestine and connect it. Like, the way it was explained to me is your intestine's kind of like your skin, and you have a couple layers before you're like in that inside tract or whatever. And they were basically able to just kind of scrape under the tumor and remove a couple of the layers of my intestine to get the tumor out, and nothing big was done to my intestines, which is like awesome. You know, that's why I say like it's a best case of a worst case scenario. So then, you know, after they do all that, I go to the ICU to recover and, you know, wake up or whatever, which I never really like woke up. Like, I was up, but then I was back asleep, and then I was up and back asleep. But I stayed in the ICU for a couple hours. I think my mom and dad said I got brought to my room like a little after 9, if I remember correctly. You know, so then they bring me to the room, and, you know, I'm not gonna lie, like Monday, Tuesday, and Wednesday, I was just like, hurt animal, leave me alone, you know, no lights, no talking. You know, I just wanted to like rest and just basically be left alone. But that whole experience was something different too, you know, that I'd never been through. And like the nurses, they were coming in. Sorry about that, I had to fix my glasses. They were coming in like every 4 to 6 hours to check on me, to give me medicine, you know, painkillers and whatever. I mean, my God, you know, I don't remember, but it was just like, there was like 6 or 7 pills, I think, that I was taking, and then they were like, here's 2 more. You know, like they come in, they give you the initial thing, and then they come by every so often to give you the pain pills. And yeah, those first 3 days in the hospital room, I had no idea what was going on. And then I would say like Wednesday, I finally got to the point where I'd carry on a conversation and kind of be awake and whatnot. They had a tube down my nose into my throat, which that thing was crazy. I also had what do you call them, the like 2 stents in the tube, you know, so I could pee in the bag or whatever. And that was crazy. One of those ended up coming out on its own, and then the night doctors had to get the other doctors, and then they just ended up pulling them all out. Like it was a whole ordeal, you know. 10 of 10 would not recommend to anybody. Like, you know, you guys, like, check your stuff, you know, because if I could have thought about it, paid attention, maybe called out something sooner, maybe this whole thing could have been a little different or whatever. But I don't know. I mean, it is what it is. But yeah, I stayed in the hospital for a week. Then I came home and stayed home for a week, and then, you know, I went back to work on the 17th of March, which, you know, I mean, I just send emails and go to meetings. I don't really do anything physical. So they were like, you know, well, if you're not doing anything physical, that's fine, because they didn't want me lifting anything over 6 pounds, you know, for like, I don't know, 6-8 weeks or something like that. So I had to really, you know, just take it easy. But fatigue was kicking my ass, you know, I get tired real easy. It took like 4 weeks before I could even get my leg high enough to even think about, you know, straddling this bike here. So I did end up getting me a CF Moto Papio SS to just ride around on until I built up my strength to get back on the bigger bike. So I'll do another video to show the little mini bike that I got. But yeah, you know, because I mean, if you guys are like me and love riding, it's like you don't want to just not ride, you know. Let's see. So the tumor, it got sent off for dissection to be looked at, and it come back that the tumor was not a teratoma tumor. And if I hadn't said this already, you guys need to go down that rabbit hole if you got like curiosity like that, because those tumors are ridiculous. They can have teeth in them, hair in them. Like, those are some weird tumors. It is very interesting what can go on in our bodies. Yeah, but anyway, they did the dissection and it came back that basically it's like having cystic fibrosis. It's like a scar tissue buildup, is what they were saying. So yeah, I mean, it was just a big old thing, a scar tissue, and you know, nobody knows. You know, for whatever reason, something happened, or maybe something didn't happen. Like, I don't know. It just boom, there it is. You know. And then on the other lymph nodes, they didn't see any cancer. So as of right now, my mindset is cancer-free. Everything is good. The 23rd of this month, which is not this week, but next week, next Wednesday, I'll go to get a baseline on baseline CT imaging. So the follow-up procedures here is no more chemo, but they will be doing CTs or MRIs every like 3 to 4 months just to see how things are going. And with me being anemic still, the doctor has not put me on anything for it. It's just a side effect from the chemo, which hopefully, you know, as time goes on, I should get a little bit, you know, all that shit should fix itself, right? The other side effect from the chemo is my hands have been sensitive to cold. You know, I got these Thrashing Supply gloves here. You know, normally in like low 50s I can wear these and be fine, but I can't anymore. My fingertips just like get really cold. And the other morning it was just my left hand, it didn't happen to my right hand. So I think I'm kind of getting over that. Some people talk about having like ringing in their ears and stuff. I have not experienced any of that. It's just been the cold. Like, that's been my thing, is it's just like I'm cold. You know, me and one of my co-workers were like two little Bettys arguing about, you know, the temperature of the trailer on the work site. He wants it 60 degrees and I want it 74 degrees, and he keeps it cold and I have a space heater on. So it's you know, it is what it is. This is all fun and games. You know, but we do pick on each other, talk a lot of trash to one another because of it, you know, because he's diabetic. So that's where I joke with him is, you know, he's diabetic and insulin and whatnot, so he wants to keep it cold, and then I'm anemic and needs it hot. So, you know, we all got something going on, right? Ain't nobody damn perfect. Let's see, what else? Yeah, I think that's pretty much it, you know. I mean, everything is looking good. I feel fortunate. The medical staff team, you know, that I saw has been really good. I've been going to Emory in Atlanta to take care of everything. You know, I started out at City of Hope in Noonan, but again, they were like, hey, we don't normally deal with this type of cancer. We don't have the equipment to treat you and take care of you. So, you know, they sent me to Emory, and between all the Emorys downtown and the one in, what is it? DeKalb or Decatur or whatever, about Briarcliff, whatever. The one up there, you know, is where I had the surgery at, where I had the port put in. So everything's been good with them. But yeah, I think that's pretty much everything. You know, I mean, it was definitely a rough experience. The chemo was definitely rough on you. But the surgery itself, I'll show a picture now. This is what it looked like when I got home and took the bandage off at the end of the second week. And then this picture here is how it looks now. So yeah, I mean, you know, got crazy two scars, because they did the big scar when they flayed me open, right, and pulled the tumor out. And then they did another scar on my right side, just above my private. You know, it's probably, hell, I don't know, like 4 inches long, maybe 3.5 inches long. And I guess that's where they had pulled the testicle out. So, you know, yeah. So that's pretty much it that I can think of that's worth talking about. If you guys have any questions or comments or anything, ask them in the comments below, because I'm not afraid to talk about it. I'm not embarrassed or ashamed. I mean, it is what it is, you know what I mean? It's like, you know, shit happens. But you can still enjoy life, and I'm glad and thankful to be blessed to make it through that surgery, and to just be able to, you know, go back to work, get back on the bike, and just enjoy what's going on. You know, this is the 4th time I've been on the Ninja since my surgery, and I've been good for about 20-30 minutes, you know, riding. I've been riding now for almost 40 minutes. So, you know, it's a good feeling to get the strength back and get back kind of in the swing of what I was doing beforehand. I don't know if I like ever feel like the same as I did before the chemo and everything, you know, because like there is like a ghost phantom feeling that I get down in my groin, like where the testicle used to be. And like you can get on Reddit and Google and read about this stuff too. Like people talk about it, but then like doctors act like it's not a thing. But like, yeah, it's a thing. Because let me tell you, I was at work and I was going into one of the construction trailers and I wasn't really paying attention, and I kind of drag my feet a little bit or don't lift my legs up very high when I walk, and the lip of the door of the trailer versus where the decking is was a little bit lower than how it is on our job trailers. And man, I kicked that damn door frame, almost busted my ass, caused the pain to go up to my shoulder because I hit it with my left foot and the pain went all the way up to my left shoulder. And then like 2 minutes later, I had like a pain in my groin, and it's just like, part of that is probably just getting old, but then the other part of it, like the feeling in my groin, I think is just like, whatever. It's just like, you know, just like, you know, something used to be there and it's not there anymore, and just every now and again I'll just get that like weird feeling down there. But I mean, it's not like painful or anything, it's just a weird feeling. But yeah, again, you know, questions, comments, ask them down below. You know, we can talk about it, and I'm glad to be back. Hopefully the weather warms up and I can get back to posting a little bit more regularly, and maybe hopefully we'll figure out some rides to do later on this summer, because I still would like to ride this bike to Florida, and then, you know, the Indian, I want to take it out. I haven't been on the Indian yet because, you know, let's be real, guys, this is a 900 and something pound bike. I want to make sure like all my strength's there, because I don't want to go out and think I'm good and drop that bike, or possibly, you know, hurt myself, hurt somebody else. So I'm gonna take my time before I get back on that one and take that one out for long rides. So build back the strength and the stamina with this thing, and then just go from there, you know, one day at a time, right? Because, you know, what else are you going to do? But thanks for tuning in. Thanks for again, you know, all the prayers and the comments and the good vibes that were put out. I really do appreciate it, guys. It means a lot. And yeah, y'all stay safe, ride safe, stay blessed, and we'll see you on the next one.